Welcome to Med-Surg Tutor, and in this video, we'll be covering eye disorders and ear disorders. More specifically, we'll be going over glaucoma, cataracts, retinal detachment, macular degeneration, and Meniere's disease. Starting off with glaucoma, we're going to discuss some patho, signs and symptoms, diagnostics, and nursing care for all of the conditions and disorders listed in this video. So, first, what is glaucoma? This is when there's too much pressure in the eye, and that pressure slowly kills the optic nerves. So, there's two things you want to look out for: open angle glaucoma, which is the sneaky one, the one that results in gradual tunnel vision, halos, and mild pain, and then angle closure. This one is the sudden medical emergency. This results in severe pain, halos, red eyes, nausea, vomiting, and blurred vision. Diagnostics, we want to look for that increased IOP, that increased pressure in the eye. That's the number one thing we want to look for. Also, we want to look for the visual fields. With glaucoma, there will be a lot of peripheral loss. Another thing is the optic disc cupping. So when you do all these testings and procedures, checking the eyes, these are the telling signs that your patient may have glaucoma. Treatment: lifelong eye drops, beta blockers, prostaglandins, CA inhibitors, miotics. And with nursing care, you want to teach your patients how to use their eye drops and stick to their medications. Make sure they're sticking to that medication regimen and avoid activities that cause that intraocular pressure to increase, such as straining and bending. And sometimes your patient will have to be operated on and go to the operating room for this condition to relieve some of that pressure. And post op teaching, you want to keep in mind no lifting and report pain or vision loss. They should not be experiencing those things. In this diagram, there's a healthy eye, which shows you the normal pressure, and then the eye with glaucoma. As you can see there, there's a buildup of aqueous humor fluid, and this is kind of what causes that increased pressure in the eye. Moving on, cataracts. So, cataracts, think a cloudy lens. People say it's like looking through a dirty window. Signs you'll see is blurred vision, absent red reflex, and a gray or milky pupil. So, what's happening is that the clouding or the opacity of the lens causes decreased light transmission, which results in impaired vision. And this is caused by protein clumping and lens fiber breakdown. Some of the signs and symptoms: blurred vision, hazy, cloudy vision, as I mentioned. And then some of the diagnostic tests is the Snellen chart test. So this result will be shows in decreased vision when your patient takes this test. And all of these diagnostics can confirm that your patient has cataracts. As far as nursing teaching, you want to teach that the surgery uh, is the only cure. And eye drops may be prescribed pre-op, such as antibiotics and mydriatics. Those dilate the pupil. And here we see the normal eye, which has a clear pupil, and then we see an eye with cataract that has a clouded lens. So one lens isn't clouded, which is the normal one, and then the other lens is clouded, which is the eye with cataracts. Moving on to retinal detachment. This one comes on fast. A classic phrase is a curtain or shadow suddenly covering vision. You might also hear about flashes or light or floaters, but this one is actually painless. So, what do you do with your patient if they have retinal detachment? You keep them on bed rest, you have both eyes covered, and you turn their head toward the side of detachment. Movement makes it worse, so safety is a priority until surgery. Here we have a healthy eye. And then on the other side, you can see the retina detaching, and that's kind of what retinal detachment looks like. Next, we have macular degeneration or AMD. This hits the center of vision. So reading, driving, or recognizing faces get tough. The sides stay clear though. So keep this in mind. This is different from glaucoma, which affects peripheral vision, but macular degeneration affects central vision. So the central vision loss, a blurry or blind spot in the center. They're going to be having trouble seeing on a day to day. You're going to want them to take the Snellen chart test. When they're taking the Amsler grids test, which is another diagnostic tools, the lines would look wavy or missing to them. There's two types of macular degeneration, dry AMD or wet AMD. So with wet, you're going to see bleeding or fluid. And there's no cure with the dry AMD, but progression can be slowed. What you want to do is encourage smoking cessation, which is a major risk factor, and promote a diet that's rich in vitamin C, E, zinc, copper, lutein, and omega-3 fatty acids. This can be beneficial to the slowing down of the condition. And here you'll see the normal eye, dry macular degeneration, and wet macular degeneration, kind of what's going on that patho. Last but not least, now for the ears. Meniere's disease, this is when there's too much fluid in the inner ear. So the classic triad you want to look for is vertigo, tinnitus, and hearing loss. Add in ear pressure, nausea, and fatigue after they have episodes. The nursing care, you want to put your patient in a dark, quiet room, bed rest, fall precautions, and meds for nausea or vertigo, like meclizine or anad Nastran. I'm terrible at pronouncing meds. Sorry about that, guys. A huge safety issue here is that these patients can fall hard during an episode. So safety, safety, safety is very, very important here. IV fluids is also going to be helpful if they're having severe vomiting. And here you're going to see that normal ear and then that distended ear. If you look at the fluid building up, you'll see the difference. All right, guys, a quick recap over what we just went over. Let's look for the buzzwords. So, halos, think glaucoma, cloudy lens, think cataracts, curtain over vision, think retinal detachment, central vision loss, think macular degeneration. And then for that classical triad for Meniere's, vertigo, tinnitus, and hearing loss. All right, that's straightforward, high yield, and NCLEX ready. You guys got this. Happy studying.